If you're over 50 and frustrated about having to use drops every day for your glaucoma, listen up. Our next guest is here to give you some relief. Dr. Jeffrey Whitman of Key-Whitman Eye Center is here to tell us about new options designed to lower eye pressure for glaucoma patients having cataract surgery. And first of all, let me address the fact that you were kind enough to wear classic blue this morning. We really appreciate that.
Hey, I got the message.
All right. What is glaucoma for people who aren't familiar with it, and how is it usually treated?
Well, first of all, we have to understand the scope of the problem. There are over 3 million people in the U.S. alone that are affected by glaucoma, and we believe that over half of them don't even know they have it.
Wow.
Well, it's the nature of the disease. Glaucoma is a disease of high pressure in the eye that's painless, and it first starts to damage the optic nerve at the back of the eye, affecting just the peripheral vision. But if left untreated, it eventually can take away all your vision again without any feeling, without any warning. And usually in the past, our treatment has been based, ever since I've been in ophthalmology, which has been a while, with expensive prescription drops that often you had to use multiple times a day. Well, what we're doing at Key-Whitman now is going to start changing all that.
Okay, so what are these new surgical options then that you're talking about?
Well, there are two principal options we're talking about, but they're both identified as microglaucoma stents, microscopic glaucoma stents. And we're going to see in pictures on the screen now, we can see these tiny, tiny microstents, one on a penny, the other one, that's the Glaucos eye stent inject.
Wow.
And this is the Hydra stent. They're tiny, 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 and they're microscopically implanted. There's no feeling to them at all. They're microscopically implanted the same time we do cataract surgery. And if there's one take-home message for our viewers today, it's that insurance will pay for this, but only if you have it done at the same time as your cataract surgery. So it's a once-in-a-lifetime decision. So you have to ask, if you're considering cataract surgery and you have glaucoma, make sure you ask, does your surgeon perform the procedure like we do at Key-Whitman? Okay,
you performed the first Hydra stent for glaucoma patients in Texas last year, so tell us about that.
Well, I was really honored to have Aventis, the company that makes the Hydra stent, have me implant one of the first ones actually in the United States. And what we found is remarkable. We're finding over 80% of the patients that get the stent are getting off their glaucoma drop. So they're getting better control of their glaucoma.
That's amazing.
They're saving money. Hey, that's two great things. Save vision, save money.
Absolutely. So we all know how expensive prescriptions can be, unfortunately. What can viewers do to find out if they might be a candidate for this?
Well, that's the easy part. They just need to give us a call at Key-Whitman. We'll set up an appointment for you with one of our doctors that performed the stent procedure, but you need to tell us that on the phone that you're interested in what I call the miracle stent, not just the micro stent, because it works so well. And we'll get that set up for you, get you evaluated. And if you're not a candidate, we actually have other micro procedures and laser procedures that can help control your glaucoma as well.
And you have locations all across the area.
We have offices all over the Metroplex. My staff and I are at the headquarters office in Dallas off of Central between Royal and Forest Lane. Just pick up the phone, give us a call, and we'll get you set up for that evaluation. See if you're a good candidate for one of these miracle micro stents.
Good to see you. Happy New Year.
Happy New Year.
Call 214-220-EYES. That's 214-220-3937 to schedule an appointment and find out if this technology is available to you. You can also go to keywhitman.com for more information, and we'll be right back.